I don't spend a lot of time on this channel talking about the goings-on of other nations if those goings-on have no relation to the United States of America. However, today has to be different. Today, we're going to have to discuss what's going on in Canada because I think it's indicative of a trend in the West, and that trend is towards self-destruction. Today, we're going to do an in-depth deep dive into Canada's euthanasia policy. We're going to talk about why this policy was put in place, what the promise of the premise was, and how far we've gotten in such a short amount of time, and how crazy Canada is about to get in the coming years. But before we get into that, I just want you to know, even though this is a touchy subject, there's no sponsor for this video. This video is for you guys. This video was made possible by the people who signed up over on Patreon, Subscribestar, joined as members, or signed up over at my website at actualjusticewarrior.com/join. Now, the promise of the premise of euthanasia is death with dignity. The idea that if you're elderly, if you're terminally ill, if you're in hospice care, you shouldn't have to starve to death or live out the rest of your days in agony if the end is near, and essentially medication or some such thing should be provided to you so that you can go peacefully because you are already on your way out. This was always meant to be limited to people who are terminally ill, and in a lot of places where we don't have express laws about death with dignity, we have some form of this in reality. For instance, I had a great-grandmother, she was sick in Florida. In Florida, they don't really have an explicit death with dignity kind of thing. They have a DNR and all this kind of nonsense. And one of the things that I noticed from the hospice care people is that they gave us a ton of morphine in order to administer to my great-grandmother. Now, unfortunately for the hospice nurses, I have nurses in my own family, and they saw that morphine dosage, and they were like, no way, this will kill her, and they only administered what would numb the pain and not actually take her life, to the point where we was actually in a weird confrontation with these nurses when they came over and were surprised to know that my great-grandmother was still alive. Now, a lot of people don't realize that that's what's going on even in the state of Florida. A lot of people don't realize that this idea of making somebody comfortable and easing their passing into the next life is something that a lot of places that may even expressly forbid this actually have in some form or another under the table. But whenever you have express forbidding, you end up in situations where people end up suffering, and it doesn't account for all cases because unlike my great-grandmother, a lot of people would live for months or even a year in absolute agony, and that's what this statute was meant to address. Now, to that extent, I totally get it. To that extent, I totally understand it. However, I do want to give the caveat that I would heavily restrict this practice because I do believe life has possibilities, and the idea that if you're terminally ill and that death date is somewhere around 5 years out, therefore we should take you out now is absurd to me, and that is not something I would be on board with. And I'm also going to warn a lot of people to be very cautious of non-libertarians using libertarian arguments. A lot of this is presented as a personal choice, a part of personal freedom, but the thing is, the person advocating for this, the administration implementing the Canada Death with Dignity policy, is the Trudeau administration. They are not libertarian, not in any way, shape, or form. The guy is a left-wing authoritarian. This is the guy who wanted to seize people's bank accounts because they were protesting him and because they had, in his own words, unacceptable views.
You can protest. You can share your opinion at the top of your lungs. You can disagree with elected officials. You can certainly disagree with me. Small fringe minority of people who are on their way to Ottawa or who are holding unacceptable views that they're expressing. In a democracy, you can protest. You can share your opinion at the top of your lungs. You can disagree with elected officials. You can certainly disagree with me.
If your truck is being used in these protests, your corporate accounts will be frozen. The insurance on your vehicle will be suspended. The consequences are real, and they will bite. It is time for you to go home.
In a democracy, you can protest. You can share your opinion at the top of your lungs. You can disagree with elected officials. You can certainly disagree with me.
And then finally, let me say, for anyone who is concerned that their accounts may have been frozen because of their participation in these illegal blockades and occupation, the way to get your account unfrozen is to stop being part of the blockade.
Small fringe minority of people who are on their way to Ottawa or who are holding unacceptable views that they're expressing.
So the idea that this guy, Justin Trudeau, who doesn't give a damn about individual liberty, who praised Fidel Castro after he died, who praised the Chinese system because that would allow us to address climate change.
He was asked which country he most admired and referred to China.
There's a level of admiration I actually have for China because their basic dictatorship is allowing them to actually turn their economy around on a dime and say we need to go green as fast as.
Who has shown you who he is each and every step of the way, is going to win you over with some libertarian-esque rhetoric, should be an absurdity that you would not allow, and yet we're seeing people get behind this that shouldn't get behind it. Now, of course, we've already gone past, in terms of Canada, the limits that I already laid out. We've already expanded upon where we were, which was, okay, you're going to pass away, you're in pain, your death date is imminent, it's like you're on flight 828, and you are allowed to check out with some level of respect in order to not die after a long period of suffering. We've already expanded to mental conditions, and we're seeing the results of this, and we're also seeing the perverse incentives of a country that has a government-run healthcare system also being in charge of suggesting and administering death to people who are sick.
When a Canadian veteran picked up the phone and called Veterans Affairs Canada to get treatment for his combat-related PTSD and a traumatic brain injury, he expected help getting better and getting his life back. Instead, he got an unexpected and unwanted offer to help him end it through medically assisted death.
Yeah, that's right. A Canadian military personnel, somebody who served that country, who actually got injured in combat and is suffering for PTSD, called up their version of the Veterans Administration, the VAC, as it's called in Canada, seeking treatment, seeking an appointment, trying to get some care for what he was dealing with, and the person on the other line suggested, as an alternative to treatment, that this person allowed the state to kill him in order to alleviate his pain.
Multiple sources have told Global News the veteran was shocked. The agent on the other end of the phone raised MAID as an alternative to treatment out of the blue. In a statement to Global News, VAC confirmed the allegation, saying the department was recently made aware of an incident involving a veteran client and a Veterans Affairs Canada employee, where medical assistance in dying was discussed inappropriately. VAC deeply regrets what transpired.
Now, a lot of people are going to listen to that portion of the segment, listen to the outrage, and think, okay, this was a guy who was totally out of line. He might have actually put that one veteran's life at risk with his careless suggestion, but the thing is, the outrage is proof that the system is not designed for this. And you would actually be correct, except for the fact that that was 4 months ago. And right now, today, the Canadians have already passed legislation, it's about to go into effect, to add in mental conditions as eligible conditions for assisted dying.
The department says it is investigating and has apologized, noting medically assisted death should not be discussed by VAC employees or offered as a service. However, VAC wouldn't say how many vets may have received similar offers. In a statement, Veterans Affairs Minister Lawrence MacAulay condemned the interaction, saying this should never have happened and that it was completely unacceptable. The minister promised to take action so this never happens to another veteran. Both he and the department say that administrative action is being taken against the person who made the offer, but wouldn't say what that meant.
And yes, you heard that right. That Canadian's Veterans Administration official was disciplined administratively, not fired, for telling a mentally ill veteran that he should try dying rather than seeking treatment, because in reality, all this person did wrong, according to the Canadian government, was jump the gun because that part of the law wasn't exactly in effect when he was pushing it on the veteran. Now, to be clear, this is not the only controversial situation that's going on. There was actually a case in Canada that was highlighted on Tucker Carlson. However, we're going to go well beyond that segment in this discussion, where they talked about a mother who is worried about her 23-year-old son who is dealing with bouts of depression, and he he was upset largely due to the fact that he had diabetes. Now, his diabetes was pretty bad. It actually caused him to go blind in at least one of his eyes. Now, the mother, being a mother, started to look into her son's situation. She started to try to figure out what was going on. However, since he was 23 years old and he was basically stonewalling her, she couldn't really get the information that she needed. However, through some machination of events or another, she ultimately ended up figuring out that her 23-year-old son was in fact approved for euthanasia based on the fact that he was upset about not having a girlfriend, and he had diabetes, and he was blind in one eye. So 23 years old, the Canadian government was ready to kill this person. They had already approved it, and then they backed off after the mother made a stink about it. And again, this isn't even at the point where they've expanded the numbers of conditions and symptoms that one would be eligible for this assisted dying practice that is being pushed in Canada. This is based on the still broad but much more limited circumstances that were available up until this point in time. Now, to give you an idea of how close we got in that situation, the death date was actually scheduled for September 22nd of 2022. The mother found out about this and was able to intervene on September 7th. So 2 weeks away from losing this woman's son, that they were going to kill the Canadian government based on the fact that he had diabetes and he was blind in one eye. And this, of course, brings up the perverse incentive that the Canadian healthcare system produces, which, by the way, should be emphasized a lot more when we're talking about this conversation, because if the American healthcare system with private actors had anywhere near had a half of this perverted incentive to basically suggest death to expensive patients, it would be an international controversy. And by the way, the Canadian thing, to give credit to the United Nations, who I never give credit to, has produced some international controversy, because what we're seem to be seeing is that a lot of people who don't want to live with a disability because they feel like they can't afford it are choosing this option and are kind of being directed, maybe, by the Canadian government towards this option based on the fact that it's expensive for them to live with their disability, but it's also expensive for these Canadian government healthcare officials to actually deal with the disabled in their own country. So essentially what we're doing is progressing ourselves towards some form of genocide of the undesirables, and people are pretending like it's no big deal. And again, we're expanding this to mental conditions, which is patently absurd and insane. Imagine if you have depression or PTSD, like that example that we talked about earlier. You call up, you're telling them that you're feeling really low, you're feeling really bad about yourself, and rather than talking you down, like a suicide hotline would try to do, they actually talked you into a government-assisted suicide, even though you're perfectly able-bodied, and you might just be going through a low period. Look, I've had family members with mental disorders. I've had family members that have attempted suicide, and one of the things that would definitely have not helped anybody in our family was if somebody at the hospital, somebody at the government, in that case, because they're one and the same in Canada, even though some of the hospitals are private, it's a single-payer system. Don't worry about it. It's similar enough that you can understand what I'm meaning. Actually told this person, well, why don't you not try your crazy attempt that you've concocted on your own? Why don't you just schedule an appointment and we'll do it for you? Basically, no questions asked, and we'll inform your family after they pass away. And again, we don't just have to speculate on what is being incentivized by the medical system. We're going to go to another case where we talk about somebody who, again, has one of those long-term disabilities, and what this person experienced when talking to the government-funded healthcare workers was them emphasizing over and over again the cost of the treatment of this individual. One Toronto physician called this a perverse incentive for Canada's publicly funded healthcare system to prefer death over expensive treatment and support. Canada already ghoulishly speaks of medically assisted death as a policy that can save millions of dollars. So again, we have money on the mind. One Canadian patient who actually had a degenerative brain disorder, a man called Roger Foley, said the director of ethics talked about the costs of keeping him in the hospital. When Foley asked about long-term care, the director said, quote, "My piece of this was to talk to you, to see if you had any interest in assisted dying." Another doctor reportedly called a mother selfish when she refused medically assisted death for her daughter. Yeah, that's right. You have somebody who shows up to the hospital with a long-term disability, a vulnerable person in our society. They bring in the director of this government agency to have a conversation with them. The conversation is solely about the cost to the taxpayer, to the government, of maintaining this person in the hospital and maintaining their long-term treatment. Not getting the hint, Foley ends up replying and asking about what are his long-term options, and then the director just drops it on him that what he's trying to do is push him towards medically assisted dying. This was not asked for. This was not death with dignity. This was somebody at a hospital, a director in medicine, somebody who's not supposed to do any harm, pushing this to save a couple of bucks, to save the Canadian healthcare system for other people who presumably they don't want to treat either and they would think are better off dying. Then you have a mother who is considered to be selfish because she won't approve medically assisted dying for her daughter. And believe me, we're going to get to the minors thing in a minute because you won't believe where this is going next. I didn't believe where this was going next. But it's right there in the text. It's right there. It's what the advocates are calling for, and it's absurd. And by the way, a lot of this actually has to do with Canadians' views on a specific case from about 20 years ago where a minor was supposedly suffering and the father decided to kill that minor in order to relieve that suffering. So the case that kind of inspired this all in terms of Canada is the case of Robert Latimer. He killed his daughter because of her extensive medical issues, which included cerebral palsy, compressed organs, chronic pain, and the inability to talk or feed herself. He was sentenced to life in prison with no chance of parole for 10 years, and shortly after this trial and sentencing, 73% of Canadians were sympathetic to him and thought that Latimer should not have gotten that extensive sentence. He should have actually gotten a much more lenient sentence. And 41% of Canadians actually believe that these mercy killings should be considered legal.
Robert Latimer took the life of his severely disabled daughter years ago, resulting in a conviction for second-degree murder.
I was just doing something that had to be done. It was the right thing to do. You have to think of the child first, and that the law doesn't think that way. The law thinks of the law first.
Latimer hopes one day those laws in Canada will change to give people like Corvo the right to end a child's painful existence.
And that's the thing. When that is your case, that extreme example is what you're going on. A father who has to experience his daughter suffering constantly over and over again with multiple medical conditions, that father takes actions. He gets sanctioned by the state. And you see the sympathy and you see that there was love in that father's heart when he committed that action. That's what you're basing the policy on. And still to this day, 63% of Canadians not only support assisted dying, but they also support assisted dying for what is called mature minors. And this is where it's going next, and I can't even believe it. So as soon as March of this year, Canada could make moves to allow quote-unquote mature minors to actually have assisted suicide through the Canadian government without parental consent. Now, we started off, or at least the starting off point for this issue in a lot of Canadians' hearts and minds, was a father who ended his daughter's life due to the fact that she had multiple conditions, chronic pain, a bunch of other things, aka an extreme case. But it appears that the basis for this new advancement actually comes from a parent who, honestly, I find to be incredibly disgusting and sickening. Let me explain this specific case. So Abel Pelletier, I apologize if I am pronouncing that name wrong, but I'm not great with the Canadian French names, was only 4 years old when his mother, Carrie Lynn Pelletier, began petitioning the Canadian government to allow a physician to take his life in a medically assisted death. Now, for me, it is a bit of a red flag when a mother decides that she not only wants to kill her 4-year-old, but she needs to get the government involved in doing so. So obviously, I'm going to be incredibly skeptical, but maybe we're dealing with conditions that all compile in such a way, like that other case that touched the hearts and reached the minds of the Canadian people. So let's read further to determine whether or not this is a solid basis. Abel was severely disabled because of a rare condition called Mednick syndrome. This disease is incurable, although medications can manage certain aspects of the system. Still, this case is not what most people think of when they think of euthanasia or assisted suicide. They think of elderly people with terminal illness, not 4-year-olds with disabilities. But this is where Canada's notoriously broad laws permitting medically assisted suicide have wound up. And again, to understand how broad we've gotten in Canada already, pre the expansion that we're going to be talking about a little bit more in the month of March, there was actually a case of a man called Alan Nichols who got approved for euthanasia despite the fact that he only had one of the medical conditions that would allow you to be there. Now, a lot of people might be saying, was that medical condition some kind of Parkinson's disease that was just debilitating like Nancy Pelosi? Was this some form of cancer? Was he going to die anyway? And to answer all of those questions, no, it was hearing loss. Not even going deaf. It was hearing loss. Hearing loss is enough of a symptom, according to the Canadian government, for you to get assisted suicide, and that's what he was approved off of. That is not even a condition a lot of the times. A lot of the times it's a symptom, but in this particular case, that was the condition. This elderly man had some hearing loss, got approved for euthanasia. And now this already loose and dubious standard might be expanded as soon as March to include mature minors. Now, if you guys are wondering what the definition of mature minors actually is, it's important to know that across the nation of Canada, there is no solid definition for mature minors. It appears that Quebec is one of the only provinces with an age cap on what could be a mature minor, and they rank it as a minimum age requirement of 12 years old. So you can be in a situation in Canada in just 3 or 4 months, because it's technically still December, where your child can go to a school counselor, a government official, say that they're having all these problems. Remember, mental conditions count. Then get referred to a specialist, and then be put down before you're even informed. In fact, it would be illegal to inform you. And this is why you never, ever, ever trust somebody who is not libertarian, not remotely libertarian, is antithetical to libertarianism when they're making libertarian arguments, because they are arguments of convenience. One of the key things that libertarians understand is the difference between children and adults. One of the key things progressive leftists like Justin Trudeau don't understand and want to blur the lines between are the lines between children and adults. There is no line for mature minors, no solid age, except in one province. So what this means is that the Canadian government will be determining, if this goes into effect, whether or not this mature minor is old enough to make their own decisions or wise enough to make their own decisions. And considering it is Canadian government policy that these kids at age 4 can change their gender, change their sex, identify however they want, and you can't question it. In fact, there are laws against you questioning it, then no, I don't trust them to administer this policy. The insanity of allowing children before they are able to drive in the nation of Canada to consent to a physician taking their lives is unparalleled. But what's even more insane is that there are people in advocacy organizations that are arguing that the mature minor standard might be too stringent, it might be too tight. Some of these groups want this expanded to infants. Some of these groups want this expanded to the mentally ill who may not be able to make those decisions whether they're mature minors otherwise or not. This is wild stuff. This is insanity. And even the so-called moderate organizations, the Dying with Dignity group, is proposing that you do the age cap at 12 years old. So children above 12 years old can go to a physician, according to this organization's advocacy, without their parents' consent, take their own life, and we're supposed to be okay with it. I'm not even a Canadian, and I'm definitely not okay with this. I don't give a damn about this father that ended up in a bad position 20 years ago. We're so far past this at this moment. We are literally creating a society that perpetuates the killing of the next generation, and we're supposed to pretend like that's normal. We have Dr. Louis Roy from Quebec College of Physicians, again, Quebec, the only place that actually has some form of cap on mature minors, recommending that Parliament consider assisted suicide for babies up to 1 year old if they have conditions like severe deformations or very grave severe syndrome. Now, while the doctor swears this should only be done in severe cases, In reality, we went from using the language of death with dignity for elderly people and consent and control of your own body to talking about offing 1-year-olds who are already born, and I guess what is the new standard for leftism, which is a year after birth, abortions. And by the way, again, 64% of Canadians, 64%, almost 2/3 of the people in that country, the voting age people, actually support the killing of mature minors in this manner. And by the way, this isn't just speculation that this could happen. Medically assisted death for minors is something that exists in the Netherlands. It allows for 12-year-olds with parental consent and 16-year-olds without it. Additionally, euthanasia for 12 months and younger babies is also legal in the Netherlands. Its neighbor Belgium actually has no age restriction, however, requires parental consent for children younger than 18 years old, and it mandates that the child have a terminal illness or be near death. Look, this is constantly billed as healthcare. It is cloaked in the language of compassion and kindness. I mean, Justin Trudeau is such a nice guy. Remember that time when he said 50% of his cabinet is going to be women? Why? Because it's whatever year it was, and current year is a good explanation for having quotas. He's such a nice guy. He's so great. Forget about all the times he praised authoritarian dictators. Forget about the time that he directed his administration to do emergency powers and start seizing people's bank accounts because they protested him. He's so sweet and he's so kind. Look at him dressing up like an Indian to go meet people in India and dance like a total idiot. This guy totally can't be a monster, appears to be what large portions of the Canadian population believe. But here's the thing. This isn't compassionate. This is the government, in a cold, calculating way, killing off people who are undesirable in order to save money in a failing government-run healthcare system. This is the government seizing control in another way from the parents and putting that in the realm of the state. If they can kill your kids without telling you, they can do anything to you. This is not the way forward. This has gone way too far. If you're in Canada, you have to do something. You have to protest. You have to go out and vote in the right direction. Find candidates that are uncompromising and unrelenting on this issue. Again, the state is saying that it's okay for them to counsel and then kill your kid after convincing them it's okay without even telling you, and that might be implemented as soon as March. And another thing that needs to be done in order to prevent this from going any further is the Canadian government needs to restrict all immigration from the continent of Asia. Think about it. If the euthanasia can do this while they're in Asia, they're not even in Canada, think about how much more damage they could possibly do if they actually made the trip over to the country and they were actually in the nation. It would be so much worse. So yeah, you have to get Justin Trudeau out of office. You have to fight back against these government officials. You have to fight back against this mindset that this is the most compassionate thing to do, because apparently you can have Canadians fall for anything as long as you say it's good for people and it's compassionate. And of course, you need the moratorium on immigration from Asia, at least on young people immigrating from Asia, because again, the euthanasia are just running amok all over Canada. But hey, those are just my thoughts. So let me know your thoughts down in the comments below. If you like this video, you can show me by leaving a like. You can subscribe for more content. You can follow me on all my social media. You can support me via the support links in the description box of this video. This has been me talking about Canada's assisted dying program and how crazy it's gotten. Till next time.